The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, and I'm here with another edition of The Genuine Article. And with me is Dr. Stefan James, and Dr. James is Associate Professor of Medicine at Uppsala University, and he's recently published a paper in JACC that addresses the very important problem of the use of stents off-label in patients with coronary artery disease. Now, these data come from the Swedish registry, don't they, Dr. James?
Correct. So we have a nationwide registry that covers all procedures performed in the country since a large number of years. And we started studying drug-eluting stents when they came on the market in 2003.
Yeah, so it's a very large registry, and you capture every patient, and it's comprehensive, so that's very strong as a registry goes. But of course, a registry still doesn't account for every potential confounding variable, does it?
That's a very, very important point, and we try to make that clear in all the publications, that the registry is a registry, and there are always confounders that we are not able to compensate for.
Yeah. Now, when the first signal came out about a potential problem with drug-eluting stents, perhaps late stent thrombosis, a lot of focus was put upon off-label indication. I think some of that from your own publication.
Sure, yeah. So the first publication, we studied patients who were treated 2003 and 2004, and we noted an increased mortality in patients treated with drug-eluting stents. And we saw an increased rate of stent thrombosis in these patients. So we still see an increased rate of stent thrombosis, but no longer an increased mortality or MI rates.
Okay, so that the question really was whether the difficulty and the adverse events you saw with the drug-eluting stents was related to the fact that they were being used off-label or to the stents themselves. Now, how has your study addressed that?
Yeah, so the original publication was considered as being an off-label cohort. So, in fact, now we have studied patients who were treated 2003 to 6, 3 years cohort. That is 35,000 patients. And half of them, about 17,000, are treated off-label, according to the FDA criteria. And so when we compared drug-eluting stents versus bare metal stents, there's no difference, neither treated on-label nor off-label, regarding the composite endpoint of death and MI.
Good. So I recall from your manuscript that, of course, not unexpectedly, that there may be a few more complications with off-label use of stents, but if you compare drug-eluting stents and bare metal stents, both being used off-label, there's no difference in the adverse events between the two stents. Is that correct?
Correct. Of course, off-label use is going to be higher event rate, mainly because the ST elevation cohort is included in the off-label. Also, patients with long lesions, very small vessels, complicated lesions like bifurcations, chronic total occlusions, and things like that.
Sure. So all those off-label indications that you just mentioned carry with them a potential for a higher adverse event rate with any kind of stent.
Correct. Clearly higher event rate, but as you said, no difference between the drug-eluting stent and the bare metal stent cohorts.
So now that you've gathered these data, has it changed your practice of interventional cardiology? So
the interesting finding also in this study is the reduction of restenosis, because we also measure restenosis in the registry. So the benefit in reducing restenosis is higher in the patients who were treated on-label as compared to off-label. Still, our recommendations in the country are mainly focused on off-label indications, because there we think that drug-eluting stents are mainly needed in those complicated lesions, the long ones, the narrow vessels.
Multiple stents.
Yeah, multiple stents, overlapping stents, bifurcations, osteal lesions. But the difference in restenosis rates is mainly contributed to the ST elevation cohort, because we found a much smaller reduction in restenosis in the ST elevation patients as compared to the non-ST.
So are you still using drug-eluting stents in the ST segment elevations, or are you?
In ST elevation, we're not using it to a large extent. If the lesions are long and narrow, we may use them, but generally not.
Well, very interesting. I mean, these are important data, and I think they've assuaged a lot of our concerns about the use of drug-eluting stents in patients with these off-label indications. Thanks very much for that contribution, and thanks for watching.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.